Okay, welcome everyone. Just letting everyone into the meeting room. Thank you again for joining us today on these webinars that we host every day at 11 o'clock. My name's Daniel Bosco, for those of you who haven't joined us previously. As you know, we typically run technical webinars each day, covering topics from civil engineering. But on Fridays, we like to maybe take a little bit more of a light approach and a look at the construction industry from a different angle. So today we've actually invited in mates from construction, and we've got Brad Parker with us today, who's going to talk about mental health and suicide prevention, particularly in light of the COVID-19 lockdowns and the isolation that we're all going through. So I'm going to hand over the interview process to Aiden, who's our marketing and engagement leader at Bluey. And I'd like to welcome Aiden and also Brad, and thank Brad for joining us today.
Thanks, Daniel. Hi, everyone. Hope you're having a nice Friday. So I guess we'll just jump straight in to Brad. If you would like to just inform everyone a little bit about Mates in Construction, I guess its vision and purpose, and how did it begin? Bit of an intro.
Yeah, thanks, Aiden. I want to thank Bluey Technologies in the first instance. That they've been a wonderful partner of Mates in Construction. Without the likes of Bluey Technologies and others in the industry, we probably wouldn't have the program that is now considered, one of best practice worldwide. So we really appreciate the work that Bluey Technologies does with us, and we very much welcome their support. So Mates in Construction, how did it start? Its embryonic beginnings started back in around about 2007 in Brisbane. So it was a Brisbane-based idea in Queensland. They were looking, there's a fund in Queensland. It's one of these redundancy trust funds that exist in the top end of the commercial industry. And they have a component within that trust fund of insurance for all kinds of areas of insurance. So it might be outside of work as well. So they're looking at death claims between the years of 1999 and 2007. And what they found was they paid out on a series of death claims totaling nearly 400. And out of that 400, 88 were suicides. And they thought that's a little bit disproportionate. Maybe we should, investigate this a bit further. So the BERT Fund, Building Employees Redundancy Trust, that stands for, they then engaged Griffith University in Queensland. They then conducted a study which was titled the ASRAP report, which took the industry by storm. That ASRAP report found that the numbers were disproportionate. So construction workers about 2.5 times more likely to suicide than the national average. If you're between the ages of 15 to 24 years, you are 11.5 times more likely to take your life than die from a workplace accident. That was their starting point, wasn't very good. And then they started to look a bit deeper about what are those issues around the industry. One of the main issues that came out was they found that 93% of construction workers that had suicided in the past had never sought professional help. So they either didn't know where to find it, they didn't want to, or they weren't encouraged to. So I could bang on forever about Mates and about how it started, but really that was the key. And that was about looking at construction workers. How do we encourage them to seek help? And essentially we set it up in that way back all those years ago. And of course, I'm from New South Wales, I'm from Sydney. So we've only existed for about 6.5 years in Sydney. So we did get our beginnings back in around about 2008 in Queensland. But yeah, we've only been going about 6 to 7 years in Sydney.
Okay, Daniel, over to you. How did you first hear about Mates in Construction, and to what capacity did you get Bluey involved, and are we involved as of today?
Yeah, it was quite a few years ago now. I've probably lost count, but it was in the pretty early days of Mates in Construction, and I had turned up to a site induction It was over on one of the very early projects on Barangaroo, and mates had sent someone in to do a bit of a talk. It was about a 1 hour talk to everyone who was being inducted, and I was just so impressed with what they were doing and saw a real need for it in the industry. I just couldn't believe that nobody had really done anything about this previously. I mean, we all know that the construction industry is a very male-dominated industry, and people aren't really willing to talk about the way they're feeling and the issues they may be having. And the way mates in construction approached it and provided an avenue for people to talk to someone, and then just bringing that topic to the forefront so differently to the way anyone else had presented it previously really impressed me at that induction. I actually went home that night, sent them an email immediately to the president saying, I want to be involved. What can we do? I said, I'm happy to give time. I'm happy to, as a financial support, what is it that you guys need? I mean, we're a small company, we can't run your organization with our finances, but whatever we can do, we're willing to do. So we took up a couple of initiatives. We helped them print out some little documents that they were handing out at inductions originally, and provided the facilities for that. We then formed a ongoing annual partnership with them, and we've been involved in a number of initiatives since then, and we see mates as probably one of our primary kind of areas that we'd like to contribute to as an organisation as well, because we just recognise that mental health is such an important issue in the construction industry, and something that we feel can make a real difference to safety of our employees on sites.
No, it's good stuff. Good stuff. Brad, can you tell us a bit about the training programs that Mates runs to educate workers on mental health and communication, I guess, and all other areas?
Yeah, thanks, Aiden. I guess Daniel's experience is not so different to many people who they get engaged with our program as soon as they see it on the ground. When we do the training on the ground, if we need to bring in directors of companies, we've done that in the past, politicians, so ministers and so forth, we get them to come in and have a look on the ground and see the interaction of the participants we have, the workers, the people in the industry, because I think it's the best way of showing you how it's done. And that's with the general awareness training. You're right, Daniel, that goes for 45 minutes to an hour. That's like an induction program that talks about those signs. We teach those signs to look for. So what are those signs of suicidality? What could they look like? What happens when you ask someone if they're, are you okay, and they're not okay? What do you do next? And then we teach also how to keep someone safe while connecting them to help. So that's a general awareness training. That's 45 minutes to an hour. We generally try and get at least 80% of the construction site during the course of the period of the project. That's difficult. A construction site can be a moving feast. People are coming and going, but we overachieve on that. We normally get 90% for those companies who are serious about running out the program. Out of the general awareness training, we then get people to volunteer to do the next phase of our training called Connector. A connector is a person who is trained in keeping someone safe while connecting them to help. The ratio of connectors that we try and achieve on a job site is 1 in 20. It fits into a bit of research that talks about 1 in 20 people may have suicidal thoughts. They may be fleeting, but they do have them. So 1 in 20 is our ratio we try and achieve. We overachieve on that as well, generally on a construction site. And then we have, and that's for 4 hours. So 4-hour training. It's not meant for everyone. We get people to put up their hand, say that, I'd like to volunteer to do that program. We then hand those names to their employer, and their employer then, we organise with the employer to conduct that training. And then we have a third phase called ASSIST, Applied Suicide Intervention Skills Training, which is essentially 2 days of suicide first aid. That's not meant for everyone. You only need one person from the site to reach what we call MATES accreditation. So we go through that accreditation where you try and get 80%, 1 in 20 connectors, and then get at least one person, but we overachieve on that generally on a site that do the assist. An assist trained person is someone who can put a safe plan together and then connect them to the mental health professionals. So just so you know, we're not the mental health professionals. We don't seek to be the mental health professionals. We're not counsellors. We're not psychologists, but we are that bridge that's never been built. And that is those people connecting them to get to help. Remembering that stat, 93% of construction workers who had suicided in the past never sought professional help. So that's what we seek to achieve. I think we do quite well. If you've looked, we are an evidence-based, research-based program. So you can have a look at on our website and have a look at all the research we've done. We have on each board in each state an academic that sits as a director. I have in New South Wales the Emeritus Professor Michael Quinlan. He's a bit like Doc from Back to the Future. He's out there, but what he does is just magnificent. And we're always looking to see how we can better the program we have.
Good stuff. You definitely have some program there for suicide and whatnot. As Daniel mentioned earlier, he said that there's a little, quite a big range of diversity in the industry, and talking just about the lack of maybe female representation in the industry. What is it Mates in Construction doing to support women who might feel sort of outnumbered or out-machoed, let's say, in construction?
Look, great question, Aiden. I saw this question coming earlier, and I thought, what a wonderful question to ask. There's a few things that we need to understand about women participation in our industry. There's not enough, number one. I was brought up by a feminist, and she'd be happy to know that. And this is a starting point. In Mates in New South Wales, 80% of my staff are female. So I think we're punching well above our weight when it comes to gender equity in our industry for Mates in Construction New South Wales. We just recently employed a 75-year-old Dr. Peggy Tromp, and Peggy has no qualms about me mentioning her age. She doesn't look it, and she's as sharp as they come. And she's our industry engagement officer who's looking at our national industry blueprint for better mental health and suicide prevention, which is partnered with Beyond Blue. And I can talk more about that later. The women are very much a key to looking at suicide rates in construction. If you looked for a reason, no better reason to engage with women in our industry, it is that we believe that higher participation of females in construction can actually save lives. There's no better reason than saving lives. So women are very much a key, because women, we know, generally across the country in Australia, 75% of males suicide compared to 25% of females. Why is that the case? We know there's a little bit of international research that tells us that women have this really good communication network. They're very good at offloading their problems. They're very good at talking openly about issues of anxiety, depression, and mental health. Us blokes tend to bottle it up. We don't tend to do that. We're not encouraged to do it either. There's this thing about, harden up, have a cup of concrete, what's wrong with you, princess, all that sort of stuff that goes on. So women are a very important part. We know that they're really good at help offering. So women are an important part of reducing suicides, I think, in our industry. What happens when women get onto a construction site? Well, I've got to tell you, there's still a problem there. We don't, one, encourage women enough in our industry to participate, but also when they get there, I was talking to Dr. Natalie Galea just yesterday, who has done some gender equity research from University of New South Wales. And Natalie was saying to me, they may have taken down all the pornographic material in the crib sheds and the lunchrooms, but the men are still talking about it in front of the women during their lunch. That's got to stop. That's got to stop. So we have a number of women that get, to answer your question, we have a number of women that work in our, for Mates in Construction New South Wales. I put on the high vis, and I go out and I train with my staff when I can. I enjoy it. At the end of the general awareness training, generally a lot of blokes will come up and they'll line up to speak to the female staff that I have. They won't line up to me. I can't take it personally. They'll line up and they'll speak to the female staff afterwards because they somehow want to get involved and get active within our program. And that's a very important thing. So we on the ground, if we were able to support women from our industry, we know it's in the back of our mind. We do it well, I think. But I want to use this as an opportunity to encourage more women that us blokes actually need to create an environment where they feel comfortable that they're able to achieve in our industry and they can actually help reduce suicides.
Daniel, I know you're an advocate for this conversation. Do you have anything to comment on this also?
Yeah, I'm just so glad and relieved to hear Brad speak about that. I mean, sometimes you feel like a bit of a lone ranger on this topic, and it's something that, I'm extremely passionate about. And I think it's one of the biggest weaknesses in our industry is the lack of diversity in construction. And there are really good reasons why we need it. And Brad's pointed most of those out. I mean, I'm a guy who comes from a background of, I've got 2 daughters. I've got a wife who's a civil engineer. She worked on sites, in the late 90s. And it isn't possible to feel more excluded from sites than the way women are made to feel on sites on a lot of occasions, even now. And even though, as Brad says, that pornographic material has been removed from sites, the type of conversation that goes on, as a dad with 2 daughters, I wouldn't want my daughters in that type of environment. It's not right. And it's not reflective of the way the rest of society behaves now. And it's beyond what's acceptable. I walk around the streets of a morning and you walk past construction sites, and sure, we might be getting rid of the wolf whistling and whatever, but there's still that real macho culture of chest beating and a real boys club that exists within construction that needs to be broken down. And the only way to break that down is by some forced diversity in the industry. And somebody actually needs to stand up and start making this happen sooner rather than later if we're going to get on top of things like suicide prevention and other issues that form as a result of that male dominance that we have in the industry. So it's great to see Mates in Construction again leading the way on these types of issues, and I'd like to see big business supporting it more. I know they are. I've got to give some due credit to some of the larger companies. I know they're trying to make an effort to make sites more welcoming. I know that if you go back only 20 years ago, it wasn't unusual to have strippers coming to site, for Christmas parties and stuff. And, like Brad says, the pornographic images around and all of that stuff has been stamped out, and they are trying to see, more women in engineering and whatever. But I think more needs to be done on the ground as well. We need more women working on sites as well. They can add a lot of value to what we do on sites. So how we get to that stage, I think it's probably the large construction companies that have to stand up and do more.
Mm. Well, it's great to have the lines of conversation open on that one. Mm. Just moving on to, I guess, something a little more news and current. COVID-19, of course, is stressing everyone on the planet out, and been stuck at home for a month now, sure as everyone else has. I'm just wondering, Brad, how maybe the inquiries coming into Mates in Construction have changed, and what's Mates in Construction doing to assist workers and their families now with the added pressure and stresses of the coronavirus? Yeah,
well, as you probably realise, we've had to change our focus, Aiden. We can't train because of the social distancing rules. So we're stepping up now. We're not stepping back. We're actually, in New Zealand at the moment, they're in lockdown. So those sites are in lockdown. But in Australia, we're deemed essential workers. So construction sites are still open. They're still operating. So we have to then step up as well. And obviously, there's a lot of anxiety around COVID-19, and it's a bit double-edged. What we're hearing on the ground is that the workers are saying to us they're very grateful to have a job, they're grateful to have an income, but they're also worried about exposing themselves, then exposing their families and whatever to the virus. They're hopping in transport, they're hopping in, trains and buses that are empty. It's a very weird, it's a very, it's not a real sensation. It's a bit out there. They're finding that difficult. And then they're coming to work, and then they're obviously, whilst they're social distancing on site, they're trying to social distance people. In reality, does that really work? So what we're doing is we're going on site. We're offering our services. We're being invited on site to offer our services. We're practicing social distancing. We are there doing toolbox talks, startup talks, if we're asked to do that. We're providing material. I've got some material with me today, which is some posters about COVID-19. That one is with QR codes where it's a whole lot of things that they can scan and they can get advice on, but also, the anxiety related stress that comes with COVID-19, and there's a whole heap of stuff that we're going through there as well. So we've changed the focus. We're active. We're open for business. We're saying we're trying to help. It is difficult even for my staff, and we meet on a regular basis and via Zoom or whatever. We're in constant touch. We're getting feedback from the industry. The feedback we're getting is very positive. They're so happy to see us on site and offering our services. But it is an unusual situation. We are providing them with stuff like, it's normal to be sad and stressed and confused at a time like this. We're asking them to stay healthy. We're giving them a lot of tips on that, getting the facts and being aware that some of the information out there is not the right information. So it's a bit of fake news, as Donald Trump would call it. Limiting your worries, spending less time listening and watching media coverage that may help you, drawing upon your skills, not trying to drink a lot of alcohol, be careful with the alcohol or drugs, and we're there to offer our assistance. So certainly we've had to change the focus of what we generally do.
Mm. Okay, Daniel, one for you, I guess, a bit closer to home. Is there any sort of initiatives that Bluey's been implementing either since coronavirus or beforehand to keep everyone sort of happy and upbeat while working?
Yeah, of course. I think it's an important part of developing a nice team structure is to ensure that we can all support each other and feel happy during these times. Before the COVID-19 outbreak, we'd already had an initiative which we called Happy, Healthy Bluey, where we were encouraging people to get out and do exercise every day, because we recognised that physical activity is a really important part of maintaining good mental health. So we had encouraged, and we actually set a little bit of a competition for people to maintain that every day, and it became really good having some banter around the office, of who was out there doing their walks or their Pilates or yoga or whatever it was that they chose to do. We've also implemented a bit of a program for mindfulness as well, just to ensure that people are taking time out each day to sit and think and clear their heads amongst all the screens and emails and messages and everything we're faced in with a day. I think it really does put a lot of pressure on our brains to kind of process all of that. So it's really important to us that we're here to support each other, and we all take some time out each day. And I truly believe that a happy team is going to be a more effective team. So that's really important to all of us.
Yeah, definitely. And just a final one for you, Brad. Is there any initiatives that Mates is looking to bring out in the coming months, or any news you'd like to share to anyone on the webinar today to inform anyone?
Well, just to say that, we thought that we'd be inundated with a lot of case management cases, and that hasn't sort of materialised just yet. We think it may be another 6 to 8 months down the track while the industry is open. People are just trying to work, and I think a lot of the people in the industry are happy to have a job. There is some new initiatives. So Mates in New Zealand, we launched Mates in New Zealand last year. It's led by a very dynamic CEO, woman by the name of Victoria MacArthur. Obviously, they're locked down in New Zealand, so the industry is not operating. So they've come up with a unique initiative called, well, I think they called it originally the Smoko Shed or the Smoko Room. I think the New Zealand regulator over there said that they had a problem with the term smoko, so I think they call it the lunchroom or something now. Whereas that's, you know, virtual like this, using Zoom in a controlled environment where they're getting people to come in and have a chat about the anxiety around some of the anxieties and about what's next with the industry, all that sort of stuff. So we're going to take that on. It's a work in progress. We're looking at the success of that program in New Zealand. And I've got to say to the New Zealanders that are listening in and watching, Mates in New Zealand has been a breath of fresh air. We can actually learn from them. We may have initiated Mates in Construction in Australia, but I think Mates in New Zealand have just taken off. It's just been amazing. And I was over there when they did their launch last year, and it was amazing. It was just an amazing roll-up of industry and people getting behind it. So we'll be looking at some of the stuff they're doing. Obviously, we're having a look at, looking at some of our research that's starting to come out again. We're about to initiate an app. We're doing some research around that at the moment, which that's hopefully that'll be out in the next 6 to 12 months. And that app will not only allow people to have tips about better mental health and well-being, but it's also a good opportunity to get some really good qualitative research data from as well. So we're working on that at the moment. That's another work in progress. And we'll continue to adapt to the challenges that are put before us with COVID-19 and the support of the industry. Yeah.
Fantastic. All right. Well, thanks for your responses, the two of you guys. I've just posted a link into the chat there for everyone. I'm guessing there's some online material that you have, Brad, as well, if you want to send it to me. Everyone, if you would like the information from Mates in Construction, just head to that link there and just select webinar presentation PDF, and I will get that information sent around to you this afternoon. But apart from that, thanks everyone for listening in. I hope you're having a nice Friday at home and a good weekend at home. I was thinking Friday afternoons isn't going to be that much fun today, just staying here. But anyway, I hope you all have a good weekend, and thanks for tuning in.
Thank you for having me.
Thanks, Brad. Thanks for joining us. Really appreciate it.
Thank you very much.
Thank you.